Hello, dear friends, colleagues, and future junior pathologists. We are very honored to be part of a ASCP 2024 annual meeting and welcome to our today's recorded sessions on the secret life of junior pathologists. I am Pua. I'm a professor and program director of Surgical Pathology Fellowship Program at MD Anderson Cancer Center. Today, I'm going to talk about this topic together with my friend, Dr. Kwan. Dr. Kwan is an assistant professor and associate program director of medical liver, kidney, and transplant pathology at the MedStar Georgetown Medical University Hospital. We are so delighted to see such a diverse and enthusiastic audience gather here to delve into a topic that is both critical and often overlooked segments of pathologists. We have no relevant financial relationship to disclose.
So why junior pathologist? Transitioning from a trainee to being an independent pathologist can be exhilarating, but also challenging at the same time because it requires a blend of academic knowledge, practical skills, and emotional resilience. Some of common challenges include daunting workload, adapting to changes in the work environment, and assuming the legal responsibility of signing name on the pathology report, while carefully navigating the efficiency and the accuracy of the interpretation. However, we realize that there's no published study on junior pathologist experience, nor is this a topic we discuss at all. As noted in the CAP survey, we are entering a strong job market where the demand may outstrip the supply. So we think this is the right time to talk about junior pathologists who are entering the workforce and understand their needs. This is why we decided to embark on this journey of understanding the secret life of junior pathologists.
So in this session, the objectives is twofold. First, we aim to identify specific challenges that junior pathologists encounter. We will explore issues such as diagnostic uncertainty, time management, the integrations of new technologies, and the balance between professional and personal life. Second, we will discuss potential solutions and strategies to address these challenges for our junior pathologists. We will highlight best practice, mentorship opportunity, and supportive frameworks. Ultimately, we like to use this information to improve the transition experience of our junior pathologists and pave more sustainable and fulfilling career path for them.
Now, first, let's define junior pathologist. Junior pathologists are those who have been practicing independently for up to 5 years after completing residency or fellowship. Then we decided to gain better insights into this topic by conducting an electronic survey-based study that included 16 multiple choice and free text questions. The survey questions include participants' demographics, challenges faced during the transition period, clinical and non-clinical areas in which participants wish the training program had provided more guidance, and finally on wellness.
So we distributed these online surveys to over 100 recent graduates of 2 academic institutions that include MD Anderson Cancer Center and MedStar Georgetown University Hospital. A total of 39 junior pathologists have participated in this study. Here, the respondents were diverse, encompassing various age groups. So the mean age of participants was 39 years old and ranging from 32 to 52 years. Among the pathologists, 43 were female and 51 were male, and 6% prefer not to disclose their gender. And about 25% participants graduated from US medical school, and the remaining graduated from foreign medical school. On the bottom left corner, here are the number of years in an independent practice. 33% work for less than 1 year, 26% work for less than 2 years, and 41% work somewhere from 2 to 5 years. For the work setting on the right bottom, 59% of the respondents were working in an academic institution, and the remaining about 46% in a community, and 5% indicated other, which was not further described. Okay, this is a busy slide, sorry, with lots of works, but all I wanted to give you is an overview or responses to the free text questions about challenges they faced. We were able to identify several keywords and group these responses into 7 representative categories for analysis.
And here are the 7 categories. Category 1, no challenge. Category 2, challenge with pathology reporting and communication. Category 3, challenge with efficiency, case complexity, and workload. Category 4, challenge with administration. Category 5, challenge with independence. Category 6, challenge with mentorship and work-life balance. And category 7, challenge with professional identity formation. When these results were analyzed by work setting, there was no statistical difference. However, we did notice a pattern that category 1 to 4 were more commonly brought up by junior pathologists in non-academic settings, while category 5 to 7 were only commented by those in academic settings.
Now, let's dive into the details of these challenges identified by junior pathologists and discuss possible strategies to mitigate them. We will first discuss category 2 and 3, which can be summarized in one big basket of challenges with pathology reporting skills for this presentation purpose. So based on the surveys, participants mentioned that they had trouble focusing on clinically significant and relevant changes during their sign-out. Some surveys participants indicated that benign entity could be more challenging to report, which may partially be true for those who train in institutions with cancer-heavy populations, and some had trouble with finalizing ambiguous cases that require descriptive reporting way of doing it, along with efficiency and time management issue. Overall, by gaining experience in descriptive microscopy reporting skills and knowing when to let go of clinically insignificant changes, can naturally increase their efficiency and confidence in junior pathologists. So how can junior pathologists obtain these skills? So depending on the structure of their trainee program, our trainees may not appreciate what goes behind the scene before making the perfect pathology report, such as like faculty peer-to-peer consultation. Trainees also may not realize the amount of time spent on perfecting the pathology report, because pathology reporting requires careful selections of words and sentences to deliver the message with both clinical significance and legal protection. These are recommended strategies to tackle the challenges involving the pathology reporting skills for trainees and junior pathologists. Understanding that reporting is skill really is an art and a skill that needs to be taught, practiced, and mastered. For faculty, please engage your trainees in peer-to-peer consultation, formulating pathology reports, and communicating with clinicians. For trainees, you should be constantly reminded yourself to ask why and so what question during evaluations of pathology specimen. For example, why was this lesion biopsy? And what will my reporting mean to my clinical colleagues for management of this patient, etc. Once trainees have achieved diagnostic competency, we as a faculty should encourage our trainee on refining their reporting skills. Without this type of coaching or opportunity, several problems can occur in the first transition year, specifically junior pathologists who are bogged down by every detail of the histology changes, will lack in speed and struggle to complete the workload in timely manner, and their pathology report at the end may not even offer clinically relevant information that their clinical colleagues are seeking for.
Now that we've discussed the first two categories, next we will move on to category 4 of challenge with administration. Some of keywords associated with administrative challenges included billing, ICD coding, CPT coding, insurance reimbursement knowledge, navigating onboarding while adjusting to the new practice, cost-effective patient care, and not too surprisingly, those working in non-academic settings were more likely to wish that they had received additional training and guidance in administrative activities. But the reality is that many of these administrative elements are learned on the job. However, we think there are ways to help developing relevant skills before graduates enter the workforce. For instance, faculty, senior pathologists, and training programs can add a rotation at a community practice, add a management rotation, or provide courses on wealth management as a graduating gift. Meanwhile, professional organizations such as ASCP or regional societies may consider providing a targeted seminar series in the spring or in the summer for those who are graduating, focusing on these administrative topics. Surely is a collaborative efforts are needed to tackle these challenges. Now let's discuss category 5, challenge with independence. Several participants commented about feeling nervous or lacking confidence in independent sign-out during the early phase of their career as junior pathologist. All pathologists can remember the nervous feeling of clicking the sign-out button for their first case. This nervousness can stem from legal concerns or concerns about the clinical implications on the patients. Among various factors, one important psychological concept to highlight is imposter syndrome, which is defined as self-doubt of competency and fear of being exposed as frauds. Particularly in new environment and work settings, junior pathologists, regardless of their true skills and competency, they may experience imposter syndrome, which can undermine their abilities and then making them more difficult to gain independence. Also, the lack of sign-up privilege before graduation is an ongoing discussion among program directors. So compared to training in other medical fields, pathology training seemed to involve a higher level of supervision with more restrictions on trainees' activities. In the ACGME Common Program requirements, 3 levels of supervisions are described as seen here. Direct supervision with immediate availability, direct supervision available, and oversight. I think most of us will agree that many senior trainees and even some fellows may graduate without fully reaching the oversight level. Sorry, I'm gonna do it again. I realize it's a direct supervision, indirect supervision. Okay, let me start this slide over. So several participants commented about feeling nervous or lacking confidence in independent sign out during the early phase of their career as junior pathologists. All pathologists can remember the nervous feeling of clicking the sign out button on their first case. This nervousness can stem from legal concerns and concerns about the clinical implication on patients. Among various factors, one important psychological concept to highlight is imposter syndrome, which is defined as self-doubt of competency and fear of being exposed as frauds. Particularly in new environment and work settings, junior pathologists, regardless of their true skills and competency, experiencing imposter syndrome will undermine their abilities and have difficulty gaining independence. Another keyword is lack of sign-up privilege before graduation, which is an ongoing discussion among program directors. Compared to training in other medical fields, pathology training seems to involve a higher level of supervision with more restrictions on trainees' activities. In the ACGME Common Program requirements, 3 levels of supervisions are described: direct supervision, indirect supervision, and oversight. I think most of us will agree that many senior trainees and even some fellows may graduate without fully reaching the oversight level, which ACGME defines as the following. The supervising physician is available to provide review of procedures, encounters with feedback provided after care is delivered. The transition from lack of sign-up privileges before graduating to working independently after graduation can be a shock to some newly graduated pathologists, as a survey participant commented. Well, let's talk about some of the strategies to mitigate these problems. For junior pathologists, being cognizant of this psychological stress and the concept of imposter syndrome would be helpful. Also, rest assured that every junior pathologist will experience similar feelings and may overcome this phase at different time point. For faculty, let's create an environment for trainees that simulate autonomous practice, including having senior trainees sign out with junior residents, have senior trainees supervise autopsies, have residents review frozen section slides before the attending pathologists arrive, or even the simple act of allowing trainees to click the sign out button may give them enough adrenaline to simulate the conditions of independent practice. Well, if the laboratory information system allows a preliminary report option, allowing trainees to click the sign out button of this preliminary report may be explored as a way to increase autonomy and graduated responsibilities.
Now we have discussed and tackled challenges on pathology reporting and problems with independence. Let's move on to the topic of mentorship and work-life balance. As you know, these two topics are very interesting, and there are so many ongoing efforts in various organizations as well as institutions. So let me start with mentorship. This is something that I'm really passionate about. So regarding with this, many junior pathologists felt that they did not receive much guidance during the transition phase, and that the lack of dedicated mentor was also a problem. When trainees and junior pathologists are asked what was the important experience gained from the training programs, many participants chose network with mentors and friendship with colleagues. So this further emphasizes the importance of mentoring and support system to junior pathologists and for the futures of pathology practice. So in the first few years of junior pathologists' independent practice, we shape their outlook, confidence level, and reporting skill. It is that imperative that the pathology practice group take this transition period seriously and provide adequate mentoring. To address this issue, we encourage trainees to first assess the culture of the practice to ensure that the group is nurturing and willing to mentor should be one of their priorities in selecting their first job. In general, a diverse mix of pathologists at various stages of their career may indicate a healthy and stable practice. One potential problem that junior pathologists may encounter in the real life workforce is potential empty promises regarding example partnership track or advancements up in the career ladder. So to avoid those disappointment, contract negotiation should be emphasized to graduating trainees with encouragement to have partnership agreements in writings or any other promises in writing. We of course hope that the practice leader do not make any empty promises to our junior pathologists, but if this should occur, a strong peer support system will help the junior pathologists make appropriate career decisions. For senior pathologists and faculty, it will be imperative to serve as a mentor to guide the junior pathologists and also to excavate their hidden talents, such as leadership skills. One suggestion is to implement a buddy system in which the junior pathologist is assigned to a dedicated mentor for the first few months who can help with anything from diagnosis to administrative models, as well as using computer system, etc. As you know, reassurance and empowerment through mentoring will be helpful in the initial phase, but mentors should also give constructive and honest feedback, even if it may mean an uncomfortable conversation for both mentees and mentors for the betterment of junior pathologists. When it comes to work-life balance, this is easy to say and not really easy to implement. However, in this study, keywords included no time for vacations and no work-life balance. Possible factors make it difficult for junior pathologists in both academic and non-academic settings to achieve work-life balance may include high case volume, turnaround time pressure, lack of resources, for example, not having various immunohistochemical state in community practice, and increased administrative activities when they become practicing pathologists. One thing from this study that is very interesting for me is only junior pathologists working in academic setting indicated work-life balance as a challenge. So academic pathologists may experience disturbed work-life balance, probably due to increased responsibilities of other than case sign-ups, such as participations in tumor boards, conferences, and trainee education. Junior pathologists may feel that also they should take all the advantages of all the opportunity that come their way, and they may even be forced to do so to take on those new roles. So as all we know, opportunities are an excellent way to advance one's career. However, keep in mind that career advancement will not result in happiness and join if one is constantly overwhelmed with too many ongoing projects. Also, this may be an indirect reflections of hierarchy culture in academic work setting. For example, expectation to cover for senior pathologists during major conferences or holidays can be problematic, and it might cross the fine line between expecting less experienced pathologists to be good team players and abuse of junior pathologists. For trainees and junior pathologists, we encourage our junior pathologists to realistically assess the capacity for additional responsibility and never feel forced to take on new projects. It is okay to say no. I understand sometimes, even though we know that it is okay to say so, but based on our culture or any other influences might be a little bit difficulty to do so, but we have to practice to get to that ability of saying no if appropriate. For the experienced senior pathologists, we encourage you to be mindful of junior pathologists' vulnerability as they have just transitioned out of the trainee mindset, and junior pathologists should be encouraged to attend conferences, to establish social networks, improve their knowledge, and as well as encourage their academic pursuit. So the last chance for discussion is category 7. Let's move this challenge with professional identity formation. As junior pathologists acclimate to their new work environment, they will start to define who they are based on interaction with mainly two major groups, our clinical colleagues and pathology trainees. As noted in the keyword, the participants in this study commented on the challenges involving environment change and how to deal with, and reasonable requests from our colleagues such as surgeon, and reasonable demand from our colleagues, clinical colleagues, or unreasonable expectations of turnaround time from clinical team can be frustrating even for the senior pathologists, right? So as surveys participants clearly commented on this challenge. Thus, it is very important to note that pathology is a consultative medical field. This means that establishing relationships with and gaining trust from our clinical colleagues is very important and a rite of passage. We understand that interaction with clinical colleagues can be a source of additional stress and nervousness. However, most of this scenario can be handled with proper communication and displays of confidence and calmness. With confidence and effective communication skills, junior pathologists can shine in the area of, example, email communication, participation in tumor boards, and interdepartmental conferences, as well as intraoperative consultation. So the second group that junior pathologists have to interact with is our pathology training, particularly in a hospital-based practice with ACGME training programs. As noted, establishing accurate expectations of trainees or working with training can be challenging during the transition phase. Junior pathology may still struggle with diagnostic uncertainty and underdeveloped mentoring or teaching skill during their transition phase. We believe junior pathologists can maximize the opportunity through transparency of their vulnerability and focusing on connecting with their trainees. For instance, they can serve as a role model by emphasizing on the importance of lifelong learning and working up complex cases together with our pathology trainee. They can involve trainee in peer-to-peer consultation to show the real work done behind the scenes and thus being truthful, helpful mentors, and role model for trainees. Since junior pathologists are not too far from their own graduation, they can empathize with trainees, share tips on studying for board exam, and counseling the trainees on career planning. Also, junior pathologists can serve as a one-year license for trainees, encourage them to speak out whenever they feel overwhelmed, and helping them recognize symptoms of burnout. Pathology, as you know, is an international friendly medical graduate program, and many trainees sometimes can be older than trainees from other programs. So as you see in our survey, the mean age of the participant junior faculty was 39 years. As you know, if those junior pathologists who are on the younger end of the age spectrum should be cognizant of cultural diversity and show respect to trainee just as they wish to be respected, right? Also, the institutions may be able to limit exposures of junior pathologists to pathology trainees during their initial phase of working independently. When this is not possible, our advice to junior pathologists is to be transparent by sharing their own vulnerability and uncertainty with their trainees.
Now we will discuss those challenges we have a happy bee. Briefly, let's discuss the areas in which participants wish the training program had provided more guidance. This result differs slightly based on the work settings and gender. More participants working non-academic settings wish they had received additional guidance in CPT coding, billing, and cost-effective patient care. Meanwhile, those in academic setting wish they received training in effective time management and understanding the importance of turnaround time and in tumor board conference presentation skills. Other skills indicated by participants of both work settings included contract negotiation, recognizing pros and cons of various practice settings, and finance tax preparation and budgeting skills. After spending years in medical training, shifting gears to one's finances can feel abrupt and very unnatural. Training programs might be able to effectively provide trainees the information they need in this area through partnering with local and regional organizations to set up targeted seminars during the spring or summer for graduating trainees or recently graduated junior pathologists. In regards to areas in which participants wish the training program had provided more guidance, it was interesting to note that more female than male participants wished they had received additional training and guidance in leadership skills. In recent years, females and males have been entering medical school in almost equal numbers, but females are still underrepresented in leadership in medicine. While leadership and soft skills are high in demand, and all potential leaders can benefit from leadership programs, given this disparity, increased institutional and departmental support will be needed in training programs and the workforce to excavate the unseen leadership potentials in women. To encourage women in medicine to advance in their career, they'll benefit from sponsorship, mentorship, visibility, and transparency. Approaches to help women cultivate their leadership skills could include positively encouraging female colleagues to apply for leadership positions and providing appropriate support, introducing female trainee colleagues at networking events, or encouraging female trainee colleagues to attend networking events for visibility, and promoting an unbiased leadership selection process for transparency. So for instance, removing name and gender on the CV for review committee. Regarding the free text questions about strategies to decrease burnout, 26 participants replied, and the comments could be grouped in 4 broad categories, which were number 1, category 1, social and wellness activities. Category 2, positive working environment centered around trainee advocacy. Category 3, faculty interaction and offloading of cases. In category 4, not applicable or no burnout. This information can be utilized as a way to decrease burnouts in trainees. So this study has limitations due to relatively small number of participants from only 2 academic centers. However, in the future, we aim to expand the data by including multiple centers and more participants. Although we cannot generalize the participant statements and survey responses to all junior pathologists, we still believe that our participant cohorts were diverse enough and represented our sample that closely parallels the broader junior pathology population. We hope that this article will initiate a discussion about improving training and the transition experience for junior pathologists, which is an important but long neglected cohort.
So in conclusion, in our session, we identified key challenges faced by junior pathologists in great details and offer possible solution which requires collective efforts from trainee program, experienced pathologists, and professional organization to facilitate their transition experience. So let me divide into 3 groups in this conclusion. First part is for trainees and junior pathologists. It is crucial to take the most out of the training program with focus on diagnostic and reporting skill. Then finding mentors who can provide guidance and support findings as support system. Junior pathologists should also actively engage with professional organizations such as the American Society for Clinical Pathology, College of American Pathologists, United States and Canadian Academy of Pathology, as well as local pathology society. These organizations offer invaluable networking opportunities, allowing junior pathologists to connect with peers and established professionals. Networking can lead to collaborative opportunities, exposure to new ideas, and potential career advancements. The second group that I'd like to focus is for senior or experienced pathologists. So mentoring junior pathologists can be time-consuming. However, that will be very helpful defining our junior pathologist career trajectory and offer insight based on their own experience. They can help navigate complex cases, offer advice on managing workloads, and provide emotional support during challenging times. Experienced pathologists play a crucial role in supporting their junior colleagues. One important strategy is to identify and nurture hidden talents among junior pathologists by recognizing and fostering those talents. Senior pathologists can help juniors build confidence and develop their skill further. Sponsorship goes beyond mentorship. Senior pathologists should actively advocate for their junior colleagues, helping them gain visibility within the organization and the broader pathology community. This can involve recommending them for important projects, inviting them to speak at conferences, and endorsing their application for awards and recognition. Leadership training program can also help junior pathologists develop the skill needed to take on leadership roles in their future. These programs should also include workshops on effective communication, conflict resolution, team management, and strategies planning. Number 3 group that I like to focus is for professional organization. They offer specific events or seminar tailored toward for junior pathologists. This will be helpful for recruitment and continuations of gaining support. This event can focus on leadership development, enhancing soft skills and administrative knowledge. Topics such as CPD coding, billing practices, time management, and cost-effective patient care should be covered in depth in this setting. Professional organizations can also provide platforms where junior pathologists can showcase their work, share their experiences, and learn from others. This could be through dedicated sessions at conferences, special interest groups, or even online forums and webinars. It is important to recognize that the needs for junior pathologists may vary based on their work setting and their own interests. Tailored support is essential to address these differing needs. So in summary, today's lecture is not just an academic exercise, but it's actually a call to action with emphasis on mentorship. It is also an invitation to collectively support the growth and development of the next generations of pathologists. By understanding their journey, acknowledging their challenges, and actively working towards solutions, we can ensure that they are well prepared to meet the demands of their vital roles in healthcare.
We would like to end the session by sharing a success story of mentorship. While I was a trainee at MD Anderson Cancer Center, Dr. Ong, a speaker of this session, was my program director. A small idea about conducting a study on junior pathologists really evolved into a paper publication titled The Secret Life of Junior Pathologists, Challenges and Future Directions. And this paper was led to an invitation to share this information as a lecture format in ASCP 2024 annual meeting. So if a mentorship and support can transform a small idea into a significant achievement, imagine what junior pathologists can become with the appropriate guidance and encouragement from training programs, colleagues, senior pathologists, and professional organizations. So together through a collective efforts, we can support the next generation of pathologists and pave the way for a brighter future in pathology. So thank you for your attention, and I look forward to our continued discussion and collaboration on these important topics.